In the previous lecture, we saw that understanding the bioethical issues arising from the use of cloning techniques requires drawing a distinction between reproductive and therapeutic cloning. The techniques for obtaining a clone are similar in both cases, but the uses of the resulting embryonic cells are very different. In reproductive cloning, the aim is to produce human embryos to implant into the wombs of women. This will produce human babies with genomes identical to the nucleus donors. In therapeutic cloning, the aim is to produce human embryos genetically identical to the nucleus donor, but these embryos are used for research or for the harvesting of stem cells, then destroyed. Reproductive cloning is typically the technology which triggers the strongest moral reaction, but therapeutic cloning is sometimes also seen as morally problematic. So, in this lecture, we'll focus on the research and therapeutic applications of cloning. I will start with a couple of more technical details about the way in which embryonic stem cells are cloned. Very generally speaking, cloning creates a line of embryonic stem cells genetically identical to an individual. The most widespread technique for creating such stem cells is somatic cell nuclear transfer. What happens during somatic cell nuclear transfer? The nucleus from a somatic cell, that is an ordinary body cell of an organism, is inserted into the denucleated egg of another female member of the same species, or even that of another species, in which case the clone produces a chimera. Then this triggers the developing of the embryo. Clones can also be produced by twining, by splitting apart an embryo. If done early enough, each clump of cells will develop into a separate individual. This is what happens naturally when identical twins are produced. Cloning is associated with a big promise concerning new therapies for currently untreatable conditions. Stem cells that are created through cloning are said to contribute in two major ways to developing new therapies. For example, the clone of someone with Parkinson's disease will have the same genes as that person. By examining this clone, scientists might learn how genes contribute to Parkinson's disease, and they might also contribute to finding a cure. Moreover, at an early stage, the cells of the clone have the potential to become a whole organism, or a heart, liver, or some other organ. Organs grown from these stem cells could be used as transplants for the original nucleus donor with a very low chance of rejection. It is argued that to secure these potential benefits, we must produce clones, conduct research on them, and harvest stem cells from them, then destroy the embryos. Despite their potential medical benefits, there are clinical, ethical, and social issues that we need to take into account when weighing the moral permissibility of using stem cells produced through cloning techniques. These issues will be different depending on whether the stem cells are to be used for therapy or solely for research. Let's look at a couple of clinical issues. From a clinical perspective, there are several variables that need to be taken into account when weighing the benefits or the big promise of therapeutic cloning. At present, there is no guarantee of how successful these prospective therapies will be, for example, the use of stem cells in replacing nerve cells lost in Parkinson's disease patients. Also, a more practical problem is that at present it is hard to find suitable stem cell donors. Obtaining and storing a patient's embryonic stem cells is also technically challenging. consider only the following 2 points. Mutations have been observed in stem cells cultured for a number of generations, and some mutated stem cells have been observed to behave like cancer cells, attacking the organism. Moreover, cultured stem cells could be contaminated with viruses which would be transferred to a patient in the case of a transplant or of a therapy based on specific stem cells. To this one must add a series of ethical issues that need to be considered when treating the practice of therapeutic cloning. Is it right for therapeutic cloning purposes to create embryos and then destroy them? Wouldn't embryos come to be viewed in this process as a commodity rather than as something that could develop into a person? And at what stage of its developmental process should an embryo be regarded as and treated as a person? Finally, when weighing the benefits and dangers of therapeutic cloning, we should also consider at least 2 important social aspects of this practice. One needs to educate the public about what stem cells can and can't do. This is very important, especially as nowadays much research that is being carried out on embryonic cells is done by commercial clinics. This implies that the reported successes are often not subject to peer review. The danger from this is that patients could be exploited by paying for expensive treatments and being given false hope of a cure, as stem cell therapies are only in their developmental stages. But most arguments in bioethics that are raised against therapeutic cloning put into question the moral status of the human embryo. Let us focus on one of these arguments. Although this argument is not typically presented in conversation or even in writing as a logic book style argument, I'll present them in this way to make it easier to identify potential objections to it. So, this is the argument. Premise 1. It is morally wrong to kill one of us. Premise 2. The early embryo is one of us. Premise 3. In therapeutic cloning, the early embryo is destroyed before it is 14 days old. Conclusion: therapeutic cloning is morally wrong. Notice that an important underlying assumption of this argument is that being one of us entails having a moral status or the right to live. According to premise 2, the early embryo shares this right to live. The argument 1 is deductively valid, so if its premises are true, then there is no possibility of its conclusion being false. So therapeutic cloning has to be wrong. But wait a minute. There is one way we can rationally reject the conclusion of argument 1, namely the claim that therapeutic cloning is wrong. And this is by rejecting at least one of the premises. We cannot touch premise 3 because it is true that embryos in therapeutic and research cloning are destroyed before they are 14 days old. To evaluate premise 1, we need to use one of the existing ethical frameworks. These frameworks might give different answers regarding the truth or falsity of premise 1, so that seems to be a lengthy business. But if questioning premise 1 is not taking us very far very quick, we can try to evaluate premise 2, namely that the early embryo is one of us. Because if we could show that the early embryo isn't one of us, that it has no right to live, then our problems will disappear. If such is the case, then the moral absolute "do not kill" does not apply. And the way would be clear for everyone to accept that there is no moral problem with destroying embryos in early stages of development, as it is done in therapeutic cloning. But here we run into the problem of defining the embryo. One might think that appealing to the scientific picture of what an embryo is might help us solve this problem. Here is the scientific picture. Fertilization, sometimes called conception, is a 24-hour process, complete at the point of synonymy, when the genetic materials by the sperm and the egg have fused. The product of the fertilization is a zygote, a single-celled organism. After 5 days, the zygote becomes a blastocyst, or a so-called pre-implantation embryo, a hollow ball of about 100 cells, from some of which the embryo will develop. Other cells will become the placenta and the umbilical cord. About 2 days later, the blastocyst will implant itself into the womb, triggering biochemical signals from the mother, on which further development depends. About 75% of fertilized eggs fail to implant. 14 days after fertilization, at about the 2000 cell stage, the cells start to differentiate. This is the primitive streak. The beginning of the nervous system starts to appear and individual organs starts to develop. After 7 weeks, the organs are recognizable and the embryo becomes a fetus, the forerunner of the baby that will, all being well, be born 9 months after fertilization. The word embryo can be used to cover all stages from synonymy to 7 weeks, although one can also talk of the pre-implantation embryo up to 7 days. In talking of the early embryo, one typically means the embryo up to the 14th day. Even with the scientific picture in hand, though, we can ask ourselves, can we find here necessary and sufficient conditions for being one of us? My gambit is that we might not be able to find conditions that are both necessary and sufficient to be one of us, but the exercise of trying to do so might still be instructive about what this argument is trying to accomplish. A simplifying assumption that many people make in debating these arguments about therapeutic cloning and the moral status of the embryo is that being human is a necessary condition for being one of us. Then what is left is to ask, is being human also a sufficient condition for being one of us? If this is the case, then given that the embryo is human from the moment of synonymy, the embryo would count as one of us from the same moment. Is this the whole story? Apparently not, because some have argued that being human does not suffice for being one of us. Instead, it has been pointed out that the necessary condition for being one of us is to be a human being. So then we have a slightly different argument. Let's look at sub-argument 2, which is part of argument 1. Sub-argument 2 goes as follows. Premise 1. It is a necessary condition of being one of us that a thing be a human being. The early embryo is not a human being. Therefore, the early embryo is not one of us. This revised sub-argument relies on the distinction between being human and being a human being. Still, we have a problem with accepting that being a human being is the necessary condition of being one of us. To accept this is to accept that before the 14th day, the embryo is morally equivalent to the bundle of skin cells under our fingernail when we scratch our head, for instance. Both are human, but neither is a human being, and neither therefore can be said to have the right to live. But if on the other hand we think that the potential for being a human being is a sufficient condition, then we might get the following sub-argument. Premise 1. It is a sufficient condition for being one of us that the thing have the potential to become a human being. Premise 2. The early embryo has the potential to become a human being. Therefore, conclusion, the early embryo is one of us. This argument is deductively valid and its second premise cannot be contested. So, to the extent we have reason to believe the first premise, we have reason to accept the conclusion of argument 3, which is premise 2 of the argument we started with, argument 1. Nevertheless, we can still find a couple of objections to this way of rephrasing the argument, namely the sufficiency condition for being one of us. Because, 1. The potential for being something does not always confer the rights that go with actually being that thing. Compare the potential doctors who do not have the rights of actual doctors. Then, human eggs and sperm have the potential for being human beings. But think about what implications there will be to conferring the right to live on gametes. Finally, more than human eggs and sperm, in fact, every cell in our body has the potential to become one of us, given the techniques of somatic cell nuclear transfer. Conferring the right to live on skin cells, for instance, will also have serious ramifications for daily life, not to say about policy. So, it seems that our beliefs about whether the early embryo matters morally will ground our beliefs about whether or not the early embryo can be killed, or whether it must be accorded the right to live, as if it were equivalent to a human infant. So, where does this leave us? It seems that there are non-conclusive reasons for believing both. 1. It is a necessary condition for being one of us that a thing be an actual human being, and the early embryo is not an actual human being. And 2, it is sufficient condition for being one of us that something has the potential for being a human being, and the early embryo has the potential for becoming a human being. But claims 1 and 2 cannot both be true. To hold the first position, that stems from accepting claim 1, is to have some reason to believe that premise 2 of the argument we started with is false, that the early embryo is not one of us and does not have the right to live. For someone who believes this, therapeutic cloning will be morally acceptable, even if you are a deontologist and you think killing is wrong across all cases. To hold the second position is to have some reason to believe that premise 2 of argument 1 is true, so the early embryo is one of us and has the right to live. For such a person, therapeutic cloning will be morally unacceptable, even if that person is a utilitarian and she has to take into account greatest happiness for the greatest number. A virtue ethicist or a care ethicist will have to take on board all these arguments in deciding whether or not therapeutic cloning is in line with the virtues or with their principles of care. So again, we reach the point at which each one of us must make a decision about the moral acceptability of therapeutic cloning based on the general ethical framework and on evaluating the deductive validity of the potential arguments. But making a decision might, of course, be just to keep an open mind and decide to follow debates and the scientific developments concerning therapeutic cloning.